Let's now look at some tips for lowering your heart rate. You can see that the tips cover the three main causes of elevated heart rate. That sympathetic nervous system response we talked about, physical deconditioning, and stimulant ingestion. Let's start with limit alcohol. The recommendation is to limit alcohol consumption to 7 drinks or less per week. The large study featured here showed that compared to non-drinkers, those who consumed excess alcohol experience elevated heart rates. If you are a heavy drinker and you reduce your alcohol, you can reduce your resting heart rate by up to 8 beats per minute. If you want help lowering your alcohol intake, please visit my course on limiting alcohol. Avoid nicotine. The next recommendation is to avoid nicotine. Nicotine comes in many forms: cigarettes, cigars, nicotine gum, nicotine patches, e-cigarettes, vaping. This large study showed that nicotine use, in no matter the form, led to elevated heart rate. In fact, compared to someone not using nicotine, someone who is ingesting nicotine on a regular basis has up to 7 beats per minute higher heart rate. So going from nicotine use to non-use can reduce your heart rate by up to 7 beats per minute. If you're using a nicotine product to quit smoking, I highly encourage you to continue to use nicotine products instead of tobacco, but in the long term, it's better to be off both products. The next recommendation is avoid stimulant medication. The primary class of stimulant medications are used for ADHD. They include Vyvanse, Adderall. Now, if you do have a legitimate diagnosis of ADHD and these medications help you function, if it's causing your heart rate to be elevated, it's really a risk-benefit analysis. Is the benefit of taking the stimulant greater than the harm from having an elevated heart rate? That's a decision you'll have to make. But if at all possible, limiting your use and the dose of stimulant medication when you have an average resting heart rate that's elevated is an important step to take. This large study showed that people on stimulant medication have up to 10 beats per minute higher resting heart rates than those not on medication.